Hello, everyone. Dr. Nikhil Verma here. I want to go over some of the treatment options in regenerative medicine or orthobiologics space that we offer here at Essential Sports and Spine Solutions in Columbus, Ohio. I hope you find this useful, and if you do, I would love for you guys to set up an appointment with us and see if these treatment options are available for you and can help you get better. So let's start with a question. What if a treatment existed that gave you 91% patient satisfaction, 74% treatment responder rate, with a very, very less than 1% complication rate? And what if this data was backed over 40,000 documented patient cases? Doesn't that spark a little interest? Doesn't that give us an opportunity to start thinking about other treatment options that aren't in the mainstream? That's what this talk is going to be about today. So, in my background training, physical medicine and rehabilitation and interventional spine, we see this big frustration of the orthopedic treatment gap. As you can see, we have the conservative therapies, we have physical therapy, non-steroidal anti-inflammatory medications like ibuprofen, meloxicam. We have Tylenol, we have ice, heat, TENS units, all these things. And somewhere in the middle, we have interventional procedures such as steroid injections or maybe sometimes nerve stimulators. But those are about our only options at this time. If these treatment options aren't viable for you, then you're jumping to surgery. And that's quite frequently what I see in the current medical model is where patients are going to their primary care doctors with these complaints. They might get referred to physical therapy or chiropractor. But when they don't get better, they go straight to the orthopedic surgeons. And nowadays, more and more surgeons are like, hey, I don't know if you're ready for surgery. We're going to hold off until we absolutely need to do this. So we see a lot of temporary fixes, steroid injections, time. But we know that the steroids can damage the tissue over time. There's a lot of times that we just wait and see, is this going to get better? Without taking proactive steps to help heal the injury and prevent further injury. Quite frequently in the world, in the musculoskeletal world, we're doing these injections blind. We're not using image guidance, and the evidence shows that we need to be doing these procedures with some visual guidance to ensure accuracy, that we're doing it in a proper way. And then we'll talk a little bit more about this gold standard of the destructive catabolic pathways rather than the healing anabolic pathways. So here's what this is all about. The promise of harnessing your own body's innate power to heal. Orthobiologics or regenerative medicine, they're not just another injection. It's more of a philosophy of how our bodies can use its own innate healing powers when amplified, can help remove damaged tissue in a sense, and it can help stimulate your body's natural response to heal. And this is why this is so promising, and our evidence is increasing every year of how we use these appropriately and what we need to use these appropriately for. And this is a great slide because it talks about this is a shift from the destructive or catabolic metabolism in our body to restorative or anabolic, which is anabolic is building up. So that is the key cornerstone, I should say, of this treatment, these treatment modalities. So let's talk about what we have here to offer at Essential Sports and Spine Solutions. We're using everything that's evidence-based tools, personalized approaches for your specific condition and your biology. Not all of these treatments work for all people, and sometimes these treatments aren't an option for people. So that's where the consult comes in place, and have an honest conversation with myself or someone from my team, and we talk about, is this a great treatment option for you? Do I believe this is going to help you based on our current evidence? We don't do things that are not FDA approved. We don't do things that would jeopardize our patient's risk and safety or health. So we're doing everything that has FDA approvals to make sure that we're staying in the guidelines and not doing things that are too cowboyish, if you will, a wild card. So we're really keeping this in the lines of treatment options that we were able to do. And we'll walk through all these today. As you can see on the left-hand side here of the screen, MLS Laser Therapy, we have Prolotherapy, we have Platelet-Rich Plasma, we have Marrow Aspirate Concentrate, and we have microfragmented adipose tissue or lipofat procedures. So briefly, let's talk about Prolotherapy. It's Prolotherapy sparking your body's repair signal in a certain sense to help solidify tendons. And that's really where our most evidence is in tendons and ligaments. And we use a highly concentrated sugar water and inject into these weakened tendons and ligaments, again, under visual guidance, to make sure that we can solidify and potentially heal some of these areas. Where's the evidence? So a 2020 meta-analysis concluded dextrose prolotherapy is more effective in the treatment of chronic pain compared to saline injections or exercise, with effects lasting from 6 months to a year. That's something that we see in our practice. It doesn't always last longer, but that also amounts on how much tissue damage there is. If there's some tissue damage that's been there for a while, sometimes it takes multiple sessions to get over the hump of that chronic pain and chronic instability from these injuries. Next, let's talk about platelet-rich plasma. This is the starting point of my career in regenerative medicine. This is what I learned about the first when I was just in residency, over 10 years ago. And we were talking about these things and their utilization. And it was really in infancy at that point. I really didn't understand a lot about it, but over the next several years, I did more studying and research with some of the leaders in the field. But what is it? It's concentration of your own bloods, where we take the platelet segment of the bloods and we centrifuge it and concentrate those platelets down. Typically, we do this twice because we want to get the highest concentration of platelets accessible for the patient, and that gives us better results for treatment options. It's an in-office procedure. It's done very quickly. I will say relatively quickly, and there's lots and lots of bad players in the PRP world, but there's lots of good players. And we're trying to pair ourselves up with the leaders in the field so we make sure that we're using the highest evidence-based treatment algorithms. We'll just give the evidence for osteoarthritis, where there's a lot of evidence. It's proven to be better than the hyaluronic acid or the gel injections that a lot of people are getting. And that's pretty significant, in 18 randomized controlled trials. The durability results extend beyond 1 year. So sometimes these hyaluronic acid injections, they only last about 6 months, maybe a year. So if we're seeing patients getting good results with this high platelet dose count, that's why we double spin it, for longer than a year, then why are we going to these gel injections? And quite frequently, it's a conversation I have with my patients, is if you're going to do something, you're going to pay a lot of money out of pocket, we should probably consider doing platelet-rich plasma. There's also evidence for platelet-rich plasma for tendinopathy, specifically tennis elbow. That's where the most evidence is, but we're also using it for other tendons, and the evidence is growing. Patellar injuries, gluteal tendinopathy. This is quite frequently what people call greater trochanter bursitis. It's usually typically a tendinopathy of the tendon in that region and not the bursa. That's just a little information out there that's a little bit frustrating for people in our field when these diagnoses are misleading our patients for treatment algorithms. We also see other rotator cuff tendinopathy and patellar tendinopathy. I think there's growing evidence in all of these things. Next is bone marrow aspirate concentrate. This is more of a master repair, as you see here. These bone marrow aspirate contains a high volume of the mesenchymal stem cells, hematopoietic stem cells, and anti-inflammatory proteins in messengers such as IRAP and alpha-2 macroglobulin. These are very effective in different healing cascades. And what do we use it the most for? And the most evidence is early to moderate osteoarthritis and focal cartilage defects. Sometimes when we have osteoarthritis, we see bony defects in the bones, and these treatments are viable options for those. And it's one of the most exciting fields because I think we're figuring out where else we can use this. Sometimes we add this to our PRP when we're dealing with tendinitis and tendinopathies. So here's a prospective study, 2 to 4 year durability for joint injections. There are some studies that are showing that when you actually inject these bone marrow aspirate concentrates into the bone, it can last longer than a decade. We're still in the infancy of this treatment modality, in my opinion. So we're really, really trying to figure out where this is going to be best utilized and how we're going to best utilize it for our patients. All right, moving on to the micronized fat or lipofat. This procedure is done in office as well. We take the tissue from your own fat cells. The devices are FDA 510K cleared devices, so these are legal to use. And it has a couple of roles. One, it has a scaffold and cushioning effect. The scaffold will allow proteins and other molecules to build upon and make that collagen network that you might need for a tendon, or the bony network you might need for a bone, or other issues or other damaged sites. But there's a high signaling molecules of cytokines and peptides and exosomes and all these great things that can help bring in this anti-inflammatory and regenerative environment. This is even more in its infancy because we've had a lot of regulation problems, but we're starting to grow this network and this basis of knowledge and how this works. I'm very excited about this. This is one of my go-tos for patients with moderate to severe arthritis to help them move forward in their healing cascade. Next, I want to talk about the MLS Laser Therapy. The MLS is a class 4 cold laser. It's something that we have in our office. It's non-invasive. It doesn't hurt. It can be very, very beneficial for patients. Even after one treatment session, I've seen patients leave here. They call me the next day saying, I don't know what happened. My back pain is completely gone. I tell them it's going to come back because one treatment session usually doesn't heal enough tissue. But what it does is it increases the blood flow and also increases the cellular ATP production in that area. And this can help decrease inflammation, decrease swelling, and it also has natural pain relieving properties. So it's really, really exciting to see how this stuff is moving forward. And this is so well situated that we do this quite frequently paired on with these other treatment options that we have: Prolotherapy, PRP, bone marrow aspirate concentrate, and lipofat. So yeah, as you see, supercharges these procedures, and it can really push the procedure further and get better results, hopefully for a longer period of time. So this is the other big difference, especially something that we do here in our office that other places do not offer. Precision is paramount. Most of the time, when people have wrong or failed orthobiologic treatments, it's because of one of two things. One of three things. One, it wasn't the right condition that was treated. That can happen all the time. There's a lot of mimickers of pain. There's a lot of things that will get misdiagnosed, even with advanced imaging, even with good physical exam maneuvers. Number two is they didn't use the right amount of cells or the right cell type in that region. Again, I'll go back to the PRP example. Quite frequently, if you're doing a single spin system, you can't concentrate the platelets high enough to have an effective treatment to that area. So you're really just spending a bunch of money to draw your blood out and inject it back in, which doesn't really jumpstart the healing cascade. And then number three is practices are not using visual guidance for their procedures. My mentor once told me, it's really hard to hit a bullseye with your eyes closed, even if you're standing right next to it. So why don't you just use your eyes? So this is the same mentality for these treatments. If I can use visual guidance with ultrasound to make sure my needle is going exactly to the place I need to make sure that my needle is in the right area, make sure I'm not in any blood vessels, make sure I'm not in any nerves, then this is like a cheat code, especially when we get trained and go through training courses and modules and hands-on courses and learn by experience of how to do these procedures properly. It's an absolute game changer and can definitely improve the yields of outcomes in the long run. Also, the safety of the patient. It's just very important for the safety. As we talked about, blood vessels and nerves can be hit with needles, and it's not good if that happens. And that's our essential difference. That's something that we offer here that a lot of other practices aren't offering. So here's my commitment. It's an evidence-driven, patient-first approach. My philosophy is simple. We begin with a deep understanding of you and your condition. Then we leverage the best available scientific evidence to select the right tool from our regenerative toolkit. Finally, we deliver that treatment with absolute precision. And I'm with you every part of the way, me or my team. We talk to you before the treatments, after treatments, and we follow up. We follow up very effectively to make sure that you're getting what you wanted out of this treatment. And we set realistic goals and realistic expectations. Your path to healing starts here. Come for an evaluation. We'll do a comprehensive evaluation. We'll develop the personalized treatment plan that we discussed, and we'll begin your journey back to an active lifestyle. We're helping thousands of patients a year, and it's getting really exciting, the amount of data that we're getting and the outcomes that we're producing. So here you go. Schedule a consultation online, essentialsportsspine.com, request appointment. You can call in at 614-626-8707 or use the QR code on the screen to get that request appointment website. If you have any questions or comments, please feel free to drop them in the comment section below. I'm looking forward to working with you. All right, take care. Bye.